amendment in my name, doesn't it just show an insecurity in her own argument that Jackie Baillie was not able to take a single intervention in a debate? This is meant to be a debate. And Jackie Baillie, happy with 14 seconds in to give Daniel Johnson away.
The Cabinet Secretary is so keen on interventions. Can he answer this? Did he know about this meeting and agree to it, or did it happen without his consent?
Cabinet Secretary.
No, a meeting of 5 people with one chief executive present, believe it or not, with over 160,000 healthcare workers. I don't know about every single meeting that takes place. So actually, what I would say to Daniel Johnson is when I meet with chief executives, when I meet with the chairs of health boards, not a single one of them has ever floated the idea of charging patients. And if they did, frankly, I would tell them that that issue is not up for discussion under this government. And what I would say to Jackie Baillie and to Scottish Labour, who brought this, well, it's a very serious debate and a very serious issue, not given any, I think, serious consideration by Jackie Baillie and a really, frankly, ludicrous contribution, is that we should start from the position of thanking all of our primary care teams, our general practitioners, those who work in reception, our multidisciplinary staff, but also, of course, primary care right across the piece. And I want to thank every single one of them. On her concerns about the founding principles of the NHS and thanking our healthcare workforce, let me give them also a categorical assurance that our Scottish NHS will never be sold off into private hands under this administration. The government holds true to the founding principles of the NHS, of Nye Bevan and his vision of patient care which is free at the point of need. And we should be judged on that track record. That track record, of course, is of abolishing prescription charges, removing dental charges for young people, continuing to fund free eye tests. Let us have it recorded today that this government will keep the NHS in Scotland publicly owned, publicly operated and free at the point of use. And when Jackie Baillie decries the government for having to reprofile health spending in order to have to combat sky-high inflation due to Conservative mismanagement of the economy, or indeed to afford record-high pay deals, there is one place I would love to be able to save money, and that would be in the £250 million that Scottish people are still paying the price for Labour's disastrous PFI and PPP projects building hospitals in Scotland. And of course, Jackie Baillie was only in government for the briefest of periods. She was only ever trusted in government for the briefest of periods. But she should take the opportunity to apologise to every single person in Scotland still paying the price for Labour's privatisation of our NHS. In terms of our GP practices and primary care, presiding officer, they have been impacted by Brexit, by the pandemic, of course, by the cost of living crisis. So we will continue to invest in our multidisciplinary teams. Jackie Baillie seemed to be talking them down, but 3,220 multidisciplinary staff and professionals recruited since 2018. So when you walk into your general practice, you're likely not just to be able to see the general practitioner who does a phenomenal job. You may well be able to see the physiotherapist, you may be able to see the advanced nurse practitioner, and a multitude of multidisciplinary staff right across the piece. And that is, of course, those individuals are there in order to, I will shortly, in order to be able to not just give the best service possible to the public that they're seeing, but also to ensure that the workload, which is incredible on GP practices, is being spread more evenly. I'm happy to give way to Mercedes.
Mercedes Villalba, very briefly.
Thank you. I'm very grateful to the Minister for giving way. I've previously raised my constituents' concerns about declining quality of patient care at GP practices, some GP practices in Aberdeen. I've raised this with the Cabinet Secretary. He's previously given a commitment that his officials would determine improvement plans that practices will be putting in place. I'm yet to receive an update from the Minister, so I'm just seeking today a confirmation that this will be forthcoming.
Cabinet Secretary.
Yes, I will give that update. Mercedes Villalba is absolutely right. She has raised this issue on several occasions with me. It is, of course, an issue for the local health and social care partnership, but I will endeavour to get her an update. I will end, presiding officer, by saying there are several initiatives underway which are addressing GP recruitment challenges. We have, of course, recruited 277 GPs as part of that 800 target. There will be figures published soon that will give an update to those figures. And let me just say that there's not a single silver bullet when it comes to GP recruitment and retentions. We have a number of interventions that are underway, but importantly, I also make no apologies whatsoever for doing what I can to ensure that timely access to our GP services for patients up and down the country is a top priority for this government.